youth risk behavior survey came back. We went over it for Raymond schools, and I know one of the big things was that we were waiting to see where it compared with the state and how Raymond was with everything that was going on with the state of New Hampshire compared to our issues. As a state, we've been addressing these issues together, but obviously we work in Raymond a little bit more closely with all of the work that we do with the coalition. So I'm going to share the presentation with you, hopefully. Can everybody see that? Yes?
Yes.
Okay, there we go. Okay, so this is the 2019 Youth Risk Behavior Survey for Raymond, New Hampshire and the state of New Hampshire. And I also have the years of the past. We take this every 2 years. So I've shown that so you can show where we started and where we are now. In 2000, according to the sampling of the New Hampshire Youth Risk Behavior Survey, Raymond High School had higher rates of alcohol, marijuana, tobacco, and other drugs compared with the state of New Hampshire. And that is what inspired the creation of the Raymond Coalition for Youth. UNH came to our community and asked us if we wanted to try and address these concerns, and we did, and we formed a group that eventually became the Raymond Coalition for Youth. So when we look at prevention, it can seem overwhelming and daunting, and people don't necessarily always know what it is. But it's really, if we can increase awareness to the dangers and risks associated with substance misuse and decrease access to those same substances, we can decrease use. And really, this funny, messy map is an example of all of the people and organizations that are part of the coalition who work together on these issues and talking about them, and this is what helps us make a difference. So thank you to everybody who's a part of the coalition. So with that, we'll start with alcohol. Raymond is blue and the state of New Hampshire is red. As you can see, in 2007, we were at 47% of our students reported using alcohol in the past 30 days. And with lots of programming in place, we've reduced those numbers significantly. To 2019, where it's 23%. And then we got the state of New Hampshire, which is 27%. So these are still concerning numbers, but at least they're going in the right direction and we're doing a good job. So we always like to say that just because we're doing a good job doesn't mean we need to stop or that we are all done. Because obviously those numbers, we would like them to go down, ideally to 0, if that's possible. We'll keep working on that. Binge drinking, 5+ drinks in one setting. Again, we started at 34% in 2007. We're down to 12% in 2019, and the state is 14.4. Marijuana use, which is something that we, in our office at least, have been very concerned with, knowing the legislation and the things happening in the state with therapeutic cannabis and all of the conversation around decriminalization. This is something that we were concerned about and didn't know what to expect. Our rates actually went down and they're 5% lower than the state of New Hampshire. I can tell you that our young people have done a lot of work around that. They've called, they've advocated, they've gone to Concord. They've been part of the groups that have been testifying up there, that they're concerned about this and the impact it has on their peers and their families. So we need to keep those conversations going. We all know that in the state of New Hampshire, really in the United States, cigarette use is something that there's been a lot of laws put in place. Can't smoke in public restaurants anymore. Things that have really raised a lot of awareness to cigarette use. So that going way down is obviously a good example of everybody working together. We're down to 4% in 2019. But then, of course, vaping came along, and we started collecting that in 2015 because that's when it became an issue on our radar. And yes, it did go up in Raymond, but we're still significantly lower than the state of New Hampshire. And Christine has done a lot of work with our youth action groups. This is a big topic for our middle school group. They've been very involved in talking about this and raising awareness. I know the school itself has brought people in to talk about it. They've installed detectors in the bathroom. This is an example of all of us working together in our community and these numbers going, again, they did go up, but they're lower than the state of New Hampshire, and it is an example of us continuing to raise awareness to this. This is who have ever used an electronic vape. So the last one was who regularly use. This is whoever, an example, tried it, if you will. So our numbers have been pretty consistent, lower than the state, still a need to make sure that kids know how dangerous these devices are, because we know nicotine is extremely addictive. So even trying it once can be dangerous and a risk for them to continue using. Past 30-day prescription drug misuse. Again, this was something that came on our radar in 2009. An example that there's always something on the back door waiting to come in on top of the issues that we're already dealing with. So we started collecting this data back then. We've done the prescription drug takebacks. We've done a lot of education and awareness. We are the same as the state of New Hampshire at 4%. But again, our kids and kids across the state have actively been involved in trying to raise awareness. Another piece to this is that we've worked with our regional partners, and Lindsay, who's on the call and is a graphic, amazing person. She's done a lot of graphics for us because the DEA told us that they're now confiscating pills off of the street that look identical to prescription drugs that you would get from a pharmacy. So it's very important for young people and adults to know that if they're using prescription drugs, they really have to get them with a doctor's note and from a pharmacy, because anything purchased on the street or from somebody you may not know most likely is fentanyl. So we need to be aware of that. We have a whole campaign that we've been pushing out on social media. We really need to start those conversations around the dangers associated with that. And we're hoping, again, it's on hold, but to have our DEA medication take-back event in October. We haven't gotten the yes or no to that as of yet, but the one in April was canceled. Heroin was brought to our attention in 2015, and we started collecting data on that. And it was that was the height of the opioid epidemic in 2015, when we had 6% in our high school. We put many different things in place. We started our heroin task force. Now we're down to 1%, which obviously that's 1% too many, but it huge difference, raising awareness, having conversations, connecting our resources, making sure people know about treatment and recovery services. That's where we are now. And these two substances, cocaine and methamphetamines, are not necessarily on our radar, but the DEA, Drug Enforcement Administration, and the Office of National Drug Control Policy asked us in communities to start collecting this data, or being aware of the data. We've been collecting it, obviously, because they're seeing a surgence across the United States in young people using both of these substances. So I pulled this information from the report, and you can see that it's gone down for cocaine from 6 to 4%. The state of New Hampshire did not collect this, so we did not have an answer for, or we did not have data to share on 2019 for cocaine. We did have it from methamphetamines. So, and we just did a presentation with the DEA, and he again raised concern about the influx of methamphetamines into the state of New Hampshire. They are seeing this, that it is something they want us to be aware of, and to continue to have these conversations. And obviously prevention doesn't start with methamphetamines. That's kind of the end of the line, but it being aware of it. We go back to the simple: decrease access and increase awareness. 42% of our students had at least one parent who talked with them. This is a low number considering. So this is an area that we will focus on, trying to get parents to have these conversations. We know they can be difficult. We know they sometimes bring up questions about their own use, and kids can be inquisitive. We have a whole bunch of tools on our website, and we're going to continue over the next year to try and provide resources to have these conversations, so parents will feel comfortable talking about the dangers in a simple form, so kids will know, because we know that parents and adults are the #1 influence in a young person deciding to use. The good news is that 78% agree that adults in their family have clear rules and consequences for their behavior. Now, and this is really important. Kids like guidance. Kids don't want their parents to be their friends all the time. And we know this because we hear it from our youth action students. some of our youth action students have been very vocal about parents who provide alcohol to their teenagers and how they're supposed to be parents, they're not supposed to be their friends. And that's a pretty clear message when it comes from a young person that they're saying something like that. So again, we want to reinforce this, how important rules are, and hopefully we can get that number even higher. For parents who feel it is wrong or very wrong, the first column is, again, green is Raymond, and the state of New Hampshire is red. For students to drink alcohol nearly every day, this is an area where we want Raymond to be higher, not lower, and Raymond is lower in all of these categories. So this is an opportunity, again, for us to engage parents and have a conversation about why they need to be talking with their young people about why it is wrong for them to be using alcohol, marijuana, or prescription drugs without a doctor's prescription. These are areas for growth, an area for us to make a difference here. Part of our drug-free community grant was obviously to start reducing the use and changing behaviors. So now we're at the end of our grant. Now is the time when changing behaviors, so these numbers will go up, is very important. The same ones, students whose friends feel it would be very wrong. This is where we would want Raymond to be higher again, and Raymond is lower in all of these areas. Again, these are community conversations that we can have to raise awareness. If you look at the marijuana one, friends who feel it's wrong for them to use marijuana, again, we mentioned all of the advocacy our young people have done around marijuana. So that's a message that their peers are getting. So we want to continue those conversations and applaud those young people who are speaking up for things that are important to them. They see firsthand the impact that marijuana has on their friends and family. They know that it's not a harmless substance when they're living with the consequences of somebody who's using. And students who think it would be easy or very easy to get. Again, this is something we want to decrease access, and this is an area that we really need to work on. They're reporting it's very easy to get alcohol, 55% of them, that's the majority. Marijuana is easy to get, 21% think it's easy to get a prescription drug without a doctor's prescription. And that's very concerning when we go back to what the DEA has taught us about the drugs that are on the street right now. So we want to educate those students that you need to make sure you're getting your prescription drugs from the proper place, because if you're getting them on the street, they could be even more dangerous. That's it. Overall, our information on here is very exciting because our use rates are way down. So that's exciting. That's a good news, and that's a testament to everybody who's a part of the coalition. The other areas that we need to increase, those are opportunities for us to continue working together and having conversations. That's an exciting part as well. It's also an example of how important the Raymond Coalition for Youth is moving forward. As I mentioned, we are at the end of our grant in September, but we have a sustainability plan in place to continue our work moving forward. We have grants that we're applying for. We have partnerships that we work with. So we're exciting